The Jakaya Kikwete Cardiac Institute, JKCI, is a government-owned national, specialized and university teaching hospital offering cardiovascular care, training and research services. It is the largest cardiac hospital in East and Central Africa. The institute has more than 305 employees, including world-class doctors, nurses, technicians and non-medical staff. With its 150-bed capacity, the institute has 3 operating theaters, 2 catheterization labs, a dedicated pediatric wing, and state-of-the-art intensive care unit. The institute sees an average of 200,000 patients annually, attending over 1,500 outpatients and 100 inpatients weekly from countries as far off as the United States of America and South Korea. With the establishment of JKCI, the number of patients being referred to cardiac hospitals abroad has dropped by 95%. In other words, 95% of cardiac operations that would have been done elsewhere in the world are done in Tanzania. JKCI aspires to become an internationally accredited world-class institute, providing, among other things, affordable top-notch cardiovascular management and acclaimed cardiovascular research, providing hope to many across the continent of Africa and beyond.
None of the neighboring countries does open heart surgery like we do. When you talk of open heart surgeries, we are doing the largest volume than anybody, not only in East Africa, but I can say in Sub-Saharan Africa.
Before the establishment of this institute, all the patients with cardiac problem used to receive their services outside the country, commonly India. But after establishment of this service, of this institute, we are able to serve all of them within the country. We are able to serve our neighbors who also don't have these facilities, and we are very happy that the service is the same as what is happening outside the country.
We have a variety of payment model. A patient can pay in form of cash through our bank agents. We also accept bank cards, Visa cards, as well as insurance cards from insurance firms who have agreement with us. Corporate client can enter into agreement with us for provision of medical services on credit basis. So we prepare bills at the end of the month, we give them and we provide them 30 days to pay their bills.
We are doing a lot of procedures because we do around 10 to 20 per day. And if we do not have enough money per day, we won't be able to do those kind of patients. Our team is well equipped, well experienced, and we have been doing these procedures for the past years since the institute has been operational.
If you look now, there is a study called IQ, and it deals with quality of surgeries in the world. There are 66 centers. We are one of the centers. It's only 26 countries which are involved. There are only 2 countries in Africa, we and South Africa, and Uganda just joined, there are 3. If you look on intervention, I think we are one of the few countries, less than 10 in Africa, who are using NCDR. NCDR is American Heart Association registry, again looking on quality of data.
I invite all people in need of cardiovascular treatment service to come to JKCI, and they can get treated at a very affordable price compared to other hospitals.
When they come to Jakaya Kikwete Cardiac Institute, they'll be assured to receive a very high quality of care, like any quality that you can get elsewhere in the world. We are very confident in the type of care that we provide.
One big part of our training as a specialist in cardiac surgery is to make sure that we are doing a safe surgery.
We provide a very safe and quality nursing care services that are internationally acceptable with the international standards, because we have standards for the provision of nursing care services in our hospital.
In medicine, when we talk of high quality, and I'll be more specific for heart surgery, we talk on the safety, how many patients we take to theater. They come out without complications, whether immediate complications or mid-term complication or long-term complications. If you look on the number of deaths which occur, I gave you an example of interventions. We have done over 4,000 patients, and we have 12 patients who died without complications. And if you look on our duration of stay after surgery, even the big surgeries, bypass. Our patients stay maximum 10 days, they go home. And this is, I'm talking of a surgery which takes us 8 to 10 hours.
Kwa kweli JKCI ni zaidi ya nyumbani. Nilikuwa siwezi kufanya kazi, nilikuwa siwezi kutembea, siwezi kulala vizuri, najikunja na koa damu, lakini sasa hivi niko sawa, natembea, nakimbia, niko sawa.
Ni kitu ambacho kinafanyika kwa ufasaha na kwa ujuzi na utaalamu wa hali ya juu sana. Baada ya hapo unaendelea na maisha mengine kama kawaida.
Mazingira hapa ni mazuri, huduma ya manesi ni nzuri, pamoja na madaktari pia ni nzuri.
Baada ya operation kwa sasa naendelea vizuri, na kama mwezi sasa niko vizuri kwa kweli.
I was impressed with everything is digitalized computer system, so the service has been improved. So as far as technology is concerned, I think everything was okay.
Nadhani nilivyokuona mimi na wenzangu wanaweza wakaja wakatibiwa, wakapona na wakaendelea na maisha yao na shughuli zao kama kawaida. Karibuni Tanzania sana, karibuni.
We have the state-of-the-art facility, we have the expertise, but apart from that we also have the rest of Tanzania to explore.
After the treatment, they have an opportunity to see our wildlife. There are so many tourist attractions. These are must to be seen. There are a lot of advantages of coming to Tanzania.
We are trying to invite patients, come to us Tanzania. It's safe to do your operation here. We have the same culture like all of you, and it's less expensive. And apart from that, you can take the same advantage to visit our other centers. This is the whole concept of medical tourism, that you can see the animals and we can fix your heart safely, not only fixing it.